Good afternoon, good people. My name is Gabe Albornoz. I'm chair of our County's Health and Human Services Committee, and we will go ahead and bring this session to order. Today, we will be receiving an update and have a discussion regarding our services to end and prevent homelessness. Let's just start from this place and just acknowledging and thanking the incredible CEF team for their continued dedication and leadership, as well as all of our community stakeholders and nonprofit organizations. We have seen the incredible work and progress that has been made over many years, and we look forward to hearing the updates today. This incredible division continues to be given curveballs from a policy level, from a budgeting standpoint, and these cruel and awful policies being spewed by our federal government are disproportionately impacting our most vulnerable populations. But we are here to talk about what's happening on the ground, possible solutions, and where there can be more collaboration. We are, of course, joined today by my colleague, Councilmember Lutke. Councilmember Sales is joining us virtually, but will be here in person shortly. And we are joined once again by our Council President Kate Stewart. Thank you so much, Council President Stewart. And with that, I'll turn it over to Ms. Clemens Johnson to tee this up and give us the context for today's discussion, and then turn it over to Director Hom.
Good afternoon. Just a quick review of the packet, and I want to thank DHHS CEF staff for providing the detailed information. We talked about this is our kind of usual update, but talking about some of the major areas that are within under CEF's guidance, which are our prevention programs, homeless services, our housing programs, especially those provided through the continuum of care, and overflow sheltering. So in your packet are some updated numbers, and the CEF team will share a overview PowerPoint that really goes over more of the specifics of certain programs that we weren't able to include timely in the packet. So if there's any questions, I can certainly answer, but we could go ahead and let our CEF team get started.
Thank you. And just a little housekeeping. I don't think we'll go this long, but a couple of us have a hard stop at 4 o'clock. Just to keep that in mind as we go through the presentation and Q&A. But with that, I will turn it over to Chief Hom.
Great. Thank you so much, Councilmember Albornoz. We are so thankful to be here and so thankful for the support that you have all provided to services to end and prevent homelessness. And during this unstable, unpredictable time, it was so important for me for the full CEF team to be here, because what we have in our both in our CEF senior managers who are here with me on my right and on my left, and our community partners is truly the strength of Montgomery County. We have all of the expertise, the strength and dedication we need to overcome any challenges, and we're going to do it together. So they're here with me today, and I wanted to introduce them. They interact with your teams frequently, but I thought it was important that they're here and also are part of the presentation. So we can go to the next slide, and we will start with introductions of the team. Okay, and I will pass it first to the Deputy Chief of Services to End and Prevent Homelessness.
Good afternoon. I'm Diana Pina. I'm the Deputy Chief of Services to End and Prevent Homelessness, and I will pass it. Actually, Anthony's not here yet, so maybe we will go from Anthony to Charlotte.
Hi, my name is Charlotte Taylor, and I'm the Administrator for Homeless Services. I oversee our outreach team, our diversion team, and our adult shelters. We also have family shelters that are in the Homeless Services team, and I'll pass it over to Denise Anderson.
All right, good afternoon, everyone. I'm Denise Anderson, and I manage the Homeless Services for Families team, which includes our family shelters, overflow motels, and most of our services related to homeless families. And I will pass it on to my colleague to my right, Ms. Kelly.
Thank you. Good afternoon. I'm Lasagna Kelly. I'm the manager for Healthcare for the Homeless. And our program oversees all of the primary care in our shelters and for our outreach. And we also oversee the psychiatric services within our shelters as well as outreach. And we do a lot of coordination with our hospitals on discharge coordination. And we oversee the medical respite currently we have located in downtown Rockville. And we also oversee the mobile dental services for all of our shelter residents as well as unsheltered. I will pass it to Beth.
Good afternoon. I am Beth Triggers. I'm the Permanent Housing Administrator with SAF. So I have the pleasure of overseeing our housing portfolio. So I oversee the Rental Assistance Program, our Short-Term Housing and Resolution Program, our Rapid Rehousing Programs, our Permanent Supportive Program for those that have chronic homelessness, and our Office of Home Energy Programs.
Thank you so much, everyone. And just want to say we have decades of experience here sitting at this table, and I'm so thankful to every member of this team. They've seen us through many challenges in the past and will continue to do so. So as much as the challenges are really formidable and unprecedented, we are up for the task of ensuring that our most vulnerable have the housing and services they need. And we'll talk a bit about those programs today. So before we talk about the work of each of our programs, I want to also give a picture of what we're seeing in our county as far as evictions and, of course, homelessness as a result of the evictions and other factors. So this is, I think there might be one before that. There we go. That's okay. All right, so this is just the overall eviction writs that have been received by the court, which are in the darker orange color, as well as those that have actually been executed over the past 4 fiscal years. And we've seen this data before, but actually I haven't presented it since the end of fiscal year 25. And there you can see there was a 146% increase from FY22 to FY25 in the number of evictions executed. Let's go to the next slide. So the next slide also shows a more recent trend. So these are over the last several months, where you can see a doubling of evictions just in the months of August and September. And I can report to you that our outreach providers, I joined a meeting with them this morning, and they also shared that in a recent count of unsheltered individuals that they were seeing more people sleeping in their cars in parking lots and stating that they were recently evicted. So these trends do impact directly the number of people experiencing homelessness currently. Next slide. This is our point in time count, which you all are very familiar with and have participated in. And this is where we see in the January point in time count of this calendar year, we saw a 32% increase from 2024 and counted 1,510 total people experiencing homelessness in our county. Over the last 5 years, that was a 162% increase. Next slide. When we look at the subpopulations, this is also a slide you're familiar with. Most noteworthy is that the largest increase occurred amongst family households, where we saw a doubling of family households from 103 families in 2024 to 204 families in 2025. And that says a lot about what we're seeing in our programs right now. And we'll delve a little bit deeper into that when we go to our shelter numbers, as well as our outcomes for our SHARP program, but just a significant impact on families. Over the last 5 years, it's been a 634% increase in family homelessness. Let's go to the next slide. So, of course, the factors influencing homelessness, it's the affordability of housing, the rising rents, inflation, stagnant wages. Continue to see households showing up in our housing stabilization program with large arrearages. The federal policy changes that keep coming at us certainly impact the growing number of families that are housing unstable, but also entering the homeless system, are eroding safety net resources. Domestic violence continues to be a significant factor, as well as the vulnerability of household members. So those are the factors that we are aware of. I also wanted to share the state trends. This is not something I've shared, and we received this information from the State Department of Housing and Community Development. So Montgomery County was not the only county that had a significant increase in families with children experiencing homelessness across the state. It was a 25% increase. Montgomery County did have the largest increase, but we were followed by Baltimore City and Prince George's County. There's also a large statewide increase in non-disabled people experiencing homelessness, and a statewide increase in older adults age 65 and older experiencing homelessness. And this data was not just based on point in time count data, it was based on our system data across 3 years. So it's quite definitive, and the trend we are seeing is not exclusive to Montgomery County. It is across our state, which is not surprising. And these, of course, are being driven by economic and housing affordability factors, and also the fact that there's a sharp increase in non-disabled single adults and families with children entering the system points to the fact that the many factors that we're seeing impact everyone in our community, especially those who are lower income. And because the supports are decreasing, we're just seeing this large increase across populations and also across first-time households experiencing homelessness, which we'll show data on when we go to our shelter data. Next slide. So this is data on, and we're going to go through the programs based on the flow through the system. And just in time, Mr. Anthony Young, Dr. Anthony Young is here to talk about our data with Housing Stabilization Services. And he is our administrator of Housing Stabilization Services over 3 different offices. So it's quite a job. It's the largest team in CEF. And with that, I'll pass it to him to talk a little bit about the data here.
Good evening. As my chief here, Christine Hong, has indicated, I'm Anthony Young, serving as administrator for Housing Stabilization Services. The data that you have before you is representative of the different numbers in terms of what we're seeing each year. I think of particular interest is in FY24. As you know, we had employees who were working with us who turned off. Testing. All right. We had employees who were working with us who were on a term county position, and so we lost about 20 of those. But and as you see, the numbers went up from FY23. However, we were able to, still meet the mark and serve the public. And then you see the numbers jump again slightly in FY25. And, during that period as well, what we're seeing is increase on rent rates in the county. We're seeing more people moving to the county for the wonderful benefits and jobs that we do. But also, we're seeing the economy take its toll. And so each year, these numbers are gradually going up. As you know, last thing I'll say to you is what we do in housing stabilization is we provide financial assistance for those who are at a critical point where they may not be able to pay their rent or they're facing eviction. And our whole job there is to preserve the housing. We do a great job with that. Previously, we were at 30% AMI or below, but most recently, we've been at 60% AMI, so anyone at 60% or below is eligible to apply. And that's pretty much it.
Thank you. And just wanted to add that the small increase to the housing stabilization budget that the council approved for FY25 allowed us to return to 60% area median income, so we appreciate that very much. It's helping a lot of people. And so the next set of slides are about our rental assistance program as well as our Office of Home Energy programs. I do want to say these are with Beth Driggers, but they are preventive programs, which is why I put them at the top of the presentation. So with that, I'm going to pass it to Ms. Driggers.
Thank you. So the next slide is our county rental assistance program. So this is our shallow subsidy. We call it our shallow subsidy program. It's 12 months. and it is targeted for households that are at imminent risk of homelessness or currently homeless. And it's targeted for individuals that are older individuals that are 55 years or older and or have a disability. The numbers that you see in front of you, you'll notice a jump from FY23 to FY24, and then around the same numbers for 25. And I think that speaks to some of the increases we received from council to support this program, which is very successful. It supports folks that do have that gap with their income to maintain housing. So.
Yeah, and I'll just add that the manager for this program, Kim Penley, did really a remarkable job enlisting the support of our community partners and referring more people to the WRAP program. And so I think that also accounts for the increase in numbers we saw in FY24 and 25, as well as, and I also wanted to add that I believe this program has helped us to have less of an increase amongst older adults, because this is really important, the shallow subsidy for people who are on fixed incomes, and helps them to stay stable in their housing. And let's go to the next slide.
So the next slide is our Office of Home Energy Programs. So this program assists folks with utility assistance for low-income households, helps restore and prevent the loss of home energy services, and it does have a requirement of income must be below 200% the federal poverty line. Additionally, you'll see quite a jump in these numbers. So between FY23 and FY24, in January of FY24, the state implemented something called categorical eligibility. So what that means is when households are applying for benefits such as SNAP, TANF, SSI, if they're deemed eligible, they automatically become eligible for some home energy program benefits. And so that is why you see the large increase in total applications.
And I'll just add that one of the challenges between FY24, when the categorical eligibility was implemented, and FY25 is that we were working with the state on the implementation of the categorical eligibility, and there were it was definitely, let me just say, a transition period, and so the system of reviewing and approving the applications was not as seamless as it could have been, and so you don't see a large increase in the total approved until FY25. And there you can see where the categorical eligibility and then the transition to a more efficient approval process has really increased the number of people who received utility assistance. And that was a 48% increase in the total number of households that benefited from these programs. So that state legislation was important, and more households today are benefiting as a result of the legislation and the hard work of the team. Those numbers of approved have been challenging to get to. We still have the same size staff, but they are processing many more applications. They're doing their very best. And Kelly Oland, who is sitting behind us, is the manager of the OHEP program, and that team really does incredible work every day. Utility assistance is so important because when a household is managing their expenses, utilities are often a significant part of that. So it is a part of the preventive work that we do. And with that, we can go to the next slide, and we're going to move into our homeless services programs.
So now you're looking at the street outreach map, and this outreach map shows all the providers, the outreach workers, the providers that cover these areas. So you'll see for Up County, that's every mine that covers that area. It's a large area. We've seen an increase in encampments in this area. In the Down County area is the Bethesda Kiers. And also within, if you look closely at the map, you'll see the city of Gaithersburg covers the area within the city of Gaithersburg limits. For the Silver Spring and Wheaton urban districts, we have Pathways to Housing that covers that area. And they also cover citywide youth outreach pathways to housing. Progress Place, we have 2 new outreach workers that the council approved, and they cover the central Silver Spring area.
And I should acknowledge here in this map, before we go to the emergency shelter numbers, the very largest area, the blue area, just highlighting that's covered by one outreach partner with 3 outreach workers. And I appreciate the work of Councilmember Ludke to flag the need for additional outreach there. And I'm stating this because the number of unsheltered people that we're seeing outside has increased, right? So when the outreach partners were assigned to different areas, it was because we saw the highest concentration of unsheltered homelessness in Silver Spring and Down County, and that's shifting. And I know Councilmember Ludke as well as Councilmember Balcom has brought that to my attention as well as to the attention of the county executive, and want to thank the task force that's coming together to look at this issue because we need to meet the need of everyone in our county. So this map is a good illustration of why it's challenging for our partner Everymind sometimes to respond to every outreach need immediately, because it's literally 3 outreach workers. Each partner has about 2 to 3 outreach workers, and so you can see with Everymind covering that entire blue area, that can be a challenge. And we can go to the next slide.
The next slide, this slide shows the emergency shelter for adults. And we can see that in FY23, there were 1,644 individuals in shelter. That number increased in FY24, and then we see in FY25, because that number went down to 1,926. So the people first time experiencing of homelessness also went down in FY25. There are a lot of factors contributing to that. I'm sure things that are happening globally that are impacting whether or not people are seeking services, but we see that it's been a consistent need for shelter for adults.
And I'll just add that in FY24 at Progress Place, we kept some level of additional overflow shelter open, so that can also account for the higher numbers you see in FY24. Shelter capacity certainly is a large factor in how many people we're seeing, obviously, in our emergency shelters. This data is very interesting to look at, and it's something we think about when we consider whether we should or should not increase our shelter capacity. We can go to the next slide.
Okay, now we're looking at emergency shelter for families. Similarly to with the singles, we've seen a steady increase with a huge jump that we talked about earlier with regard to the PIT between 2024 fiscal year and 2025. There's consistently been the majority of families that are being served in shelter are experiencing their first time homelessness. I would say likely due to all the factors that we mentioned earlier. Whenever things impact our community, low-income families tend to be hit a little bit harder. There are more mouths to feed. So we are just seeing an upwards trend that we are still working aggressively to try to address.
Thank you. Next slide.
Okay, for what you see here, this is shows the numbers of referrals that we receive for all of the services that we provide throughout our continuum. On any given year, we would receive we would receive anywhere between 400 to 600 referrals. So majority of these referrals come from our county hospitals, other medical facilities within our jurisdiction, and even outside our neighboring jurisdictions when we have some of our residents who are hospitalized in those particular facilities. So the numbers here represent referrals internal and external. Next slide. And this slide shows the increased number of services provided by our primary care provider that provides services in the shelters, as well as to our outreach individuals that are unsheltered. The numbers for primary care have continued to increase as well as the services for psychiatric services each year. And then with our dental services, you'll notice that there was a decrease, and part of the decrease that you would see in the numbers had to do with some of the difficulties that our provider at that time was experiencing. As you might know, we were having some difficulties and uncertainties around dental services continuing for our homeless individuals, and Dr. Mantoni and his team were able to figure out a plan for us to be able to continue our services. So currently we are actually working with another provider who will at some point take over those services that he's been providing.
Now you're looking at the short-term housing and resolution program slide. Obviously SHARP. This program is the 12-month rental assistance program. This is not a shallow subsidy. This program does pay 12 months full rental assistance for currently our families. Our families receive navigation services while they're in this program. It's currently targeting families that are experiencing homelessness. In 2025, there have been 795 adults and children housed. Since July, we have housed 95 new households. So you can see the numbers. It has been extremely successful. Next slide.
Oh wait, let's
you wanna
let's
go
wait
more?
there for
Go
a
ahead.
minute. I just have to really acknowledge the incredible work of Beth's team, the SHARP team, as well as Denise's, the family services and the family services partners. It is incredible work to house 795 people, and we have at this point housed more people in 10 months than were counted on the night of the point in time count in January. So it's just a testament to what can be accomplished when we're all united in our goal. And that is very clear in the outcomes here. So I wanted to stop and acknowledge all the workers who made this possible, but also all of you, because without you understanding the needs of the homeless population and the families that we saw coming into the system, we could not have accomplished this together. So many thanks to everyone who supported this effort and continues to do so. And for the additional funding, my apologies, the additional funding that you have proposed in light of the many challenges facing us with the federal policy changes, that is certain. We can certainly house many more people with that funding. And I thank you, Council President Stewart, and the full council for adding that to the proposed relief package. And with that, we can move to the next slide. So this is the inflow-outflow slide, which I'll talk about. This is the reason why family homelessness still is an issue, even though we've already housed 795 people and 221 families in the last 10 months. This is an indication of families entering the system, entering homelessness, which is marked by the blue columns. And then in gray, it's the families exiting the system and who are being permanently housed. So the red line indicates the net change, and you can see in February, March, and April a significant decline, a decrease in the net number of people experiencing homelessness because we were able to house so many and outpace the inflow. It was in May when we utilized all of our SHARP funds, so we had to pause a bit until the next fiscal year kicked in, and we received, with your support, permanent SHARP funding. So that's why you could see that our outflow did not outpace inflow. Now, the continual challenge is the number of families entering the system in spite of us doing this amazing work with SHARP. So as you look at the numbers, the average is 28 families entering homelessness every month. That is incredible. It's a testament to all the factors we've been talking about. And our team continues to house the families, but you can see it's a continual huge amount of work to ensure we're outpacing inflow, which we don't have control over. So the different teams involved are doing their very best, but it is a complicated calculus to get to continual declines, and eventually our goal, of course, is to end homelessness. So it takes continual work and also the support and investment in these really important programs. Let's go to the next slide. So this is the same type of data for individual adults experiencing homelessness. And here you can see, in general, inflow is greater than outflow. And that's why the red line is always above zero. There's a continual increase in individual adults experiencing homelessness. And actually, the majority of our resources are for individual adults. So this is our continual work to create housing opportunities. And I know that the council and the executive are very supportive of our partnership with our Public Housing Authority, but just we have to continue to work on both the housing affordability issue, but also developing programs intended to help individual adults and families exit homelessness. Next slide. So we'll move to our rapid rehousing program next.
So the next slide is rapid rehousing. So that is our program that is 18 to 24 months. This program is a little different. So this program, clients are reassessed every 90 days. Case managers look at their income to see what portion of their income they can pay towards their rent, with the goal, obviously, of doing progressive engagement. Over time, you're working with the client or the household so that they are increasing their portion of their income to be sustainable as soon as possible. The quicker we get households to that point, the more folks we can serve. It has intensive case management. That's what makes this program a little bit different. We offer employment services, a lot of wraparound supportive services from the community. And again, it's intended for households that can increase earned income. Over the last couple of years, you will see a decrease specifically in FY25 of the number of families and households, that we were able to serve. There's two specific reasons for that. One, the rental increases have caused programs a decrease in units to be able to offer to our households. And the second is we did lose a rapid rehousing project in our NOFO. And so that was a decrease in our capacity. Next slide. This is our permanent supportive housing slide. Obviously, it's permanent. That's the intention, and it's meant for folks that need that permanent housing and the supports that go with it. And so these folks are identified on our coordinated entry list that need the ongoing case management. They have the diagnosis of a disability, and so they need the permanent subsidy. It's for more vulnerable individuals, and that's how we decide who gets these very coveted slots. We determine it by those that would be the most vulnerable on our list, and so we were able to match them with this intervention. And it does amazing work, and so you can see over the last couple of years, there is a slight decrease, and we also attribute that some to rental increases because programs do have a rental portion, but the other part is we did also have a reduction in one of our permanent supportive housing programs within our NOFO. It had to be reduced. It wasn't eliminated, but it had to be reduced. Next slide. Diana?
Okay, and so then this next update is significant, and I want to pass it to Diana Pina because she has been the project manager for our HUD Continuum of Care Notice of Funding Opportunity applications. It's a multi-month long process. It's incredibly arduous. It involves not just SEF, but all of our HUD-funded partners, and she is an expert in this area, so I'm going to pass it to her to provide this update.
Thank you, Christine. So the Continuum of Care Notice of Funding Opportunity is the federal grant that provides support to our permanent supportive housing and rapid rehousing programs in our continuum. It outlines the rules for the continuum of care, the scoring for the programs, and the expectation for how we will operate. The current NOFO is meant to last 2 years, but the current administration has decided to publish a NOFO, and we anticipate that it could be published as soon as the government reopens. We, of course, don't know yet what the terms will be, but based on an analysis completed by the National Alliance to End Homelessness and the trends of this current administration, we have some expectations. One of them is that we expect there will be a 30% cap to the funding for permanent supportive housing and rapid rehousing to create space for different types of programs like transitional housing or supportive service only programs. And in our continuum of care, that would be a cap at 3 million. So a decrease from the about 10 million we received to 3 million. We also anticipate that there will be a scoring prioritization for agencies or COCs that agree to align with the executive order on ending crime and disorder on America's streets, which means that agencies will be put in a tough position to say if they will or will not agree to follow some of those terms, and preference would be given to the ones, of course, that say they will. We also expect that there may be some, that agencies that demonstrate that they practice DEI, harm reduction, or gender affirming care may be penalized, and agencies that do not will be prioritized. And the National Alliance anticipates that the deadline for the application will be in January, meaning that an award won't happen until about June. And this is significant because a lot of our grants for our local nonprofit agencies expire between January and June. And so they will be left with no funding, which means they will not be able to pay rent, salaries, they'll have to reduce services, and so on. So in numbers about the impact in our community. So as I mentioned, this could be a decrease from 10 million to 3 million for permanent supportive housing and rapid rehousing. It's about 800 people that we currently house through our programs. 274 of them are children. 457 are families with minors. 54 of them are 65 years or older. 14 are veterans, 33 are youth, and they're divided between PSH and rapid rehousing. So this would really have a significant impact in our community, and we could see it as early as January.
Thank you, Diana, for that update. I know you'll have a lot of questions about that. Before we end our presentation, I wanted to really thank our community partners. They do the work with us, and it's just incredible to see how many of them have been doing this work for so many years, and you'll recognize the names. This picture is from our community-wide meeting. They are our voices, along with Seth, in creating our strategic plan to reduce and end homelessness. And so just want to give a big shout out to all of them. They do incredible work every single day, and we couldn't do it without them. Next slide. And I also wanted to acknowledge the critical partnerships in each area of the work that Seth does. We work alongside county and state government as well as other partners, and it's just important to acknowledge them as well. Continual teamwork, so many discussions behind the scenes. Many of you have been part of them, and I just want to continue to highlight that everything we do is collaborative, and there are so many stakeholders in this work, and really all of us have to stand together to continue to support households that are facing homelessness and that are experiencing homelessness, so we can help them to recover and to gain stability again, which is our goal. And so I just want to thank all of our partners here as well, and to thank all of you as well. And that is our presentation.
Thank you all so much. So much to process and digest. I guess I'll start with the changes where you all left off, the changes in federal policy. How have these families been notified? Have these individuals been notified? How have we been communicating and lending as obviously as much support as we're going to be able to provide, knowing there are a lot of moving pieces, but what does that communication look like so far?
Yes, our communication started a number of weeks back when we first learned of the likely cuts. We started with our partners to plan and prepare, and also to give voice to the impact, the devastating impact on our community and communities across the country. our hope was to change the trajectory of what was to happen, and that at least there would be language in the continuing resolution that was approved to extend the notice of the continuum of care funding for another 12 months, because that was the original plan. That did not make it into the continuing resolution. And so, yes, we are at the point where the strategies we have discussed internally, we will need to move into action mode. And as far as informing those who will be directly impacted, our partners have begun doing that. Obviously, always keeping in mind the support that's needed for those who will be directly impacted. And some of them have joined in the advocacy to try to prevent these cuts from occurring. And I just want to express my gratitude to Councilmember Luedtke to joining a rally last week to try to push against this. But we are here where we are today, and so we're ready to implement next steps to respond. And we do anticipate that notice of funding opportunity dropping any day now with the government reopening.
I appreciate that. It is November, and I know the executive branch is beginning the process or continuing the process of developing your all's recommendation for the next operating budget. Without going into specifics, because you can't go into specifics, but from a high level, can you talk a little bit about how you plan to approach this particular operating budget, and if is it any different than in years past, given all of these unique circumstances?
Thank you for that question. Yeah, I can't share a lot of specifics, but I will say that the county executive, Dr. Bridgers, all of my fellow chiefs have been having many discussions to prepare for anticipated threats to our funding. So though we hoped that we in CEF hope this day would never occur, we have been discussing plans and certainly will continue to do so as the budget process proceeds. And so I can just say that there are strategies that we have discussed and will continue to do so, and we will see how that will unfold in the budget process.
Thank you. And of course, the council stands ready to be a partner, as we always have and have continued to be, and we'll be as nimble as we need to be. You certainly have that commitment from us. Can you talk more, Chief Hong, about the regional approach in response to this issue? You've been a key leader in that space, and obviously this is a regional issue. Any updates there that you can share?
Yeah, so it's been really interesting just seeing how our neighboring jurisdictions are also responding to the threats to our funding. And I just want to say it's incredible to be a part of the Council of Governments and to walk together in this journey where we're going to be having to change the way we do our work. And so many thanks to all of them, and each have innovations and different strategies that they've implemented. And I definitely am also thankful to the district's continuum of care, as well as Prince George's County. We have regular meetings with them to discuss not only our data sharing, but how we can collaborate more deeply. And we've also had some preliminary discussions with Prince George's County's new county executive on the issue of homelessness, and I'm optimistic that those discussions will create even more collaboration between our two counties. So I think that we're going in a very good direction, and one thing I have observed over time is when there is more challenge, more adversity, it means we have to band together and work more closely together on the solutions, and I do see that happening, and I'm very thankful for our partners across the region.
Yeah, I just want to add that we're also working with the state and shared with DHCD the impact to our COC so that they would be aware of the full state impact.
I appreciate that, and just one last comment and then turn it over to colleagues. So our colleagues in Prince George's are even in a more perilous situation than we are because they rely almost exclusively on federal funding. While this is going to dramatically impact our ability to serve as many families, this will essentially wipe out many of their services. And so this is a broad comment and a difficult one. We've discussed it before, but this push-pull on how much we can do here in Montgomery County will continue to be a challenge, and even more so in the coming months and years. And so we have to continue to figure out what's realistic, and just be honest about that, about the limits in the services that we can provide, and go as close to those limits as we possibly can and leverage them and be strategic and thoughtful, but there is a limit. So I'm glad to hear there are those regional conversations, because we're going to need to lean on them even more moving forward. I'll turn it over to Councilmember Lukey, followed by Council President Stewart.
Thank you, Chair Albornoz, and thank you, Director Hong, for coming last night to speak at my public safety town hall in my district. And really, so much of this has to do with educating people. And that was the top thing I heard afterwards when people were coming over to talk to me one-on-one, was how much they learned specifically about the different ways the county can approach these issues, because there is no one size fits all and there is no one approach to it. And so I think it was incredibly helpful and illuminating for folks to hear that, and to know that this is not just a problem in any one spot in the county or in Maryland. It is a problem everywhere. And I want to thank Ms. Taylor for working with my office specifically on some issues with constituents in Damascus, and again, for the careful care and attention that you all show to this issue, as well as our myriad partners who are out there doing the work. And thank you for mentioning the partnership that Councilmember Balcom and I have in trying to elevate the need for more outreach workers in the Up County. Again, it sort of manifests in slightly different ways than it does in Down County, and people make assumptions that they shouldn't about where folks have come from. And then when you have to explain, these are the people in your neighborhood, these are your people who have lived in this community for years, they handle it very differently, because it's just shocking to them that the need is so high. I remain very concerned about the continuum of care and any discontinuation of services for folks who are already in our permanent supportive housing program. And you know, I know you stated that these are individuals who are determined to have a disability. I just wanted to give you, not because I don't know, but give you the opportunity to explain a little better for the public what that means for those folks, like what having been determined to have a disability means. Because not all disabilities are visible. Absolutely, and thank you for pointing that out. So one of the challenges with the experience of homelessness is the fact that people with disabilities, one, are predisposed. It's a disadvantage in many ways, and are predisposed with other intersecting identities like race, as well as gender identity, sexual orientation. There are many intersecting factors that make it harder and tend to cause certain populations to experience homelessness more frequently, and they are overrepresented in the program, in the population. Right. In addition to that, the experience of homelessness itself is very traumatizing. So even though an individual may enter and may not have a disabling condition, the longer they experience homelessness, the more likely they are to have disabling conditions, which, yes, may not be visible. And so the work of our case managers is to assess that continually and to try to connect them up to resources. And in addition to that, respecting each individual's choice for what they choose to do. So what we do in our assessment process as we work with individuals and households is we work to assess the vulnerability, which includes disabilities, chronic health conditions as well. And that factors into the type of housing they are assessed for. And so those who are most vulnerable, and that could be co-occurring disabilities. Some of them are trimorbid and have 3 or more disabling conditions. tend to be matched or assessed for what's called permanent supportive housing. And 12 out of 13 of our HUD-funded programs are permanent supportive housing. It is for the most vulnerable that we see amongst those experiencing homelessness. And it is a cornerstone of our solution to ending homelessness because, unfortunately, due to the factors I explained, it tends to be those who are very vulnerable who have the longest experience of homelessness, which is why Montgomery County had a targeted campaign to house those who are chronically homeless. So that's sort of a summary of how those disabling conditions are assessed and why permanent supportive housing remains a very important program for that population.
And even prior to the most recent, I'll call it crisis, for lack of better term, with the Continuum of Care grants and the messing around by the federal administration of what that funding means for our jurisdiction, we still needed even more permanent supportive housing than we have available to serve those in need. And I'm very keenly aware of that. And yet, you know, we are in this position now where we have had stabilization for a great many folks who, you know, have a roof over their head and have case managers who work with them and who help support them. These are people on fixed incomes, meaning their disability prevents them from working in a way that, you know, most people would conceive of, but doesn't prevent them from getting SSDI, right, when that's functioning. I should say that, presuming that continues functioning, but that can't cover everything. And to your point about the comorbidities, the condition which may in fact have made them eligible for the disability designation in the first place may have other layers on top and may gain layers as the person ages too. So we have to be adaptive to that. And you did highlight how many of the folks in the program are over a certain age. You know, where else will they go? Where else could they go? They don't have a place to go. So I will be continuing to monitor the situation. Certainly do, you know, echo Councilmember Albernaz's sentiments about, you know, not every jurisdiction does what we do. Yet we feel the impacts when someone isn't doing everything that we are doing, then it creates some extra tension here. But first and foremost, want to make sure that we are keeping the folks who we have stabilized as possible while the rest of the world is in a state of chaos. So that's my ask. Thank you.
Of course, and I did want to also state that, as you saw in the slide about permanent supportive housing, we have about 2,200 people currently in permanent supportive housing. About 800 of those are in federally funded permanent supportive housing. We expect that about 600 will be impacted by a 70% cut in our housing programs. So in many ways, it's exactly what you said, Councilmember Albernaz. We are very fortunate to be in a county that invested so heavily into permanent supportive housing, and we don't have space for 560 people. So that is the challenge that we are currently intensively discussing at CEF and will be with our partners as well. That is the challenge that our federal government has introduced and will when this notice of funding opportunity drops.
Thank you for that. Well, not thank you for that, but you know what I mean. Right. Council President Stewart and then Councilmember Sales.
Great, thank you. Actually, my questions have been asked, so I'm just going to say thank you for all the work and what you all are doing. We know we were seeing increases before, and what is happening right now at the federal level is just really just awful and cruel. And we know the impact, as Councilmember Lukey was talking about, on families. These are our families, like people who live in our community, who are being evicted, who had stable housing and now won't. And there are children, and they're in our school system, and it's all connected. And I just want to say thank you, and know that here on the council, we are partners with you. And if there are things that we can do at the regional level, push COG even further, and our partners, as you know, I serve on the COG board. If there are things that we need to do we stand ready to do that and to stand in partnership with you. So just thank you. I'll turn it back.
Thank you so much. Councilmember Sales, are you with us?
Yes, thank
Wonderful.
you, Mr. Chairman, and to my colleagues for their comments. Director Hong, we sat on a panel not too long ago together talking about homelessness and housing insecurity and the high rates of housing, and the numbers are confirming what we've already expected, but of course it's still sobering news to hear. And so before I, get started with my questions, I did want to take the time to thank my colleague and friend, Chair Albornoz. I believe this is going to be our last committee hearing together, and just want to thank you for 7 years on the council, but for the wisdom and guidance that you have provided over the years. I know that you will always only be a phone call away, but I thank you deeply for the example of leadership and care and compassion that you've shown to ensure that this committee continues to do good work in your absence. And so I just am so grateful for your leadership and to be able to watch you over the years. And I will stop there because I know that there's going to be more opportunities to say official farewells. But so thank you.
Thank you.
Back to, of course, and back to the sobering report. We appropriated even more money for the needs of our homeless population. And I noticed in the report that our FY26 motel budget was about $800,000, but already 1.2 million has been spent just in the first 3 months. I know that you've come before the council for supplemental appropriations. Are we appropriately forecasting the needs, or are we seeing increase in the rates from the motels? What are you attributing this to, Director Hahn?
Yeah, so last year, when we were looking at our motel budget and our SHARP budget, we very much planned and hoped to be able to reduce the total number of families experiencing homelessness, which we have done. We are now at about 150 families, and so we are in a different place. And as I showed in the inflow-outflow chart, families continue, and in fact, more families continue to show up experiencing homelessness. So we have to meet that need. That is what we have committed to as a county, to ensure that no child ever has to sleep outside. So our motel budget is fluid. And because of that, even though we have done phenomenal work through the SHARP program, we still need to be able to expand to provide shelter to families as they enter the system. So, though we were optimistic in looking for a decrease in homelessness, I will say that the deputy chief was sober in her analysis. I'll pass it to her so she can add some comments about our FY25 budget planning and our thought there.
So our projection was based on the average number of hotel rooms that we have seen in the last few months. In addition to utilizing SHARP, we're also exploring how we can increase our diversion efforts and prevention efforts to be able to decrease the inflow into the family shelters. But even with those efforts of prevention and the outflow to SHARP, we think we will still serve about we'll still need 127 rooms. Sometimes that doesn't exactly equal 127 households, as they need more than one room, but that's about the average that we anticipate for the year.
Okay, and do you anticipate fully expending your budget before the year is over? That's what I'm concerned.
We have fully expended our current budget. We have already, we did that in the first 2 months.
The first 3 months?
Yes.
Yes.
Yeah, so that's been expended. And we expect that we'll need about 4 million again, a little over
4 million.
Yeah.
Okay. And so, seeing that the SHARP program has been highly successful, are there any other measures that we have been exploring to decrease our reliance on the motels?
Yeah, so diversion is a really important effort that we're trying to focus on. Several households sometimes require just short-term support of 1 to 3 months, and that is way more cost-effective than coming into shelter, because once you come into our system, it becomes much more difficult to leave. And of course, hotels are not ideal for any households with children experiencing homelessness, so they come into the hotels and now they have to face additional barriers to housing stability. So diversion, stopping the inflow, is a really important intervention. So we're trying to focus on what we can do in partnership with Anthony's team and Housing Stabilization Services to decrease inflow by providing those short-term interventions. We also work with each household on housing plans. So SHARP is not our only housing options, and Denise could explore this a little further, but we work on all the options available in the county beyond SHARP.
Just to add,
yes, go ahead.
I'm sorry, I just wanted to add to what our deputy chief was sharing. SHARP is by and far our biggest mover right now. However, we also have a number of families that are coming in having lost housing who have the resources to get back into housing with a little bit of support. We have expanded, and my colleagues will talk a little bit more about this, access to the rental assistance program as well, so that if a small subsidy is needed, that's available for families. So a lot of families are working. They are fully employed and still experiencing homelessness. And the little bit of subsidy from the rental assistance program for those can get them over the hurdle and get them back into permanent housing. In these times, we're also talking to families about being creative in their solutions, because unfortunately, even with all of the resources that we have, it's not enough to service everyone. So we have families that are looking into shared housing, who are increasing their efforts with employment as best they can as well, and just looking for whatever solutions will work to have them exit homelessness as quickly as possible.
Okay. And how is SEF preparing for the possibility of the 70% cut to the permanent supportive housing funding, and going through the budget so quickly already that the county executive?
Yeah, so I'll take that question. Before I do, I wanted to add 2 more things that are solutions for families experiencing homelessness. One is that, as Ms. Anderson mentioned, in our rental assistance program, Ms. Driggers does have the ability to make exceptions in some cases, and so we're looking at making exceptions for families who may not meet the criteria as far as having a disabling condition or being an older adult. And there are some situations both where we're at the point where we could potentially prevent a family from experiencing homelessness, where they don't meet the criteria for the rental assistance program or for the housing stabilization eviction program work, eviction prevention work we do, where both Ms. Driggers and Dr. Young have the ability to make an exception. So, for example, if a family doesn't currently have the income to pay off an arrearage, but will soon, to pay rent consistently, we may make an exception in that case to prevent that family from entering the system. It's a challenging thing to do because we don't have the budget to change the criteria so that we can, for example, pay a larger arrearage or serve more families based on their income. However, our teams look very carefully at the many factors involved, the rent that they have to pay, their income, and try to prevent as many families as we can from entering the system. And then, as Ms. Pina mentioned, diversion continues to be a really important intervention so that we can try to connect those households to other family members or friends who they may be able to stay with, and then hopefully avoid an experience of homelessness. So I just wanted to add those to our response overall for other solutions for families. And then as far as our strategies for the impending cuts to our federal funding, this is something we have been discussing internally, but what we are looking at doing is certainly looking at our existing resources and trying to determine how we can maximize them and perhaps spread them by adjusting the length of time for some of the subsidies. I don't want to go into too much detail because we haven't worked out all the details. It will certainly impact our partners' work as well as those who are served by it. But those are some of the things we're considering, as well as our partnership with state, perhaps requesting, not perhaps, we really need to request gap funding, given that some of the HUD funding will start to expire and lapse in January, as well as working with the Housing Opportunities Commission. They themselves are a HUD recipient for permanent supportive housing, and our hope is that perhaps they can partner with us in opening up some vouchers for the many households that will be impacted by these cuts. And then, of course, discussing other solutions with Dr. Bridgers and the county executive to see what is possible. Those strategies are more fleshed out. I just don't want to share them yet because they are currently just strategies.
Of course. Thank you for the heads up, and thank you that you're even already anticipating, strategies to mitigate whatever the impact will be, which is going to be great. Speaking of capacity and thinking about potential staffing changes, we are entering into hypothermia season. Luckily, it's, climate change is upon us and we've seen warmer days, but we know that the cold nights are going to be coming. What are the most immediate staffing needs or resources needed to manage overflow during this season, and how are we preparing for this?
Thank you for that question. I will pass it to Charlotte Taylor to respond.
Okay.
Sorry. At this time, the shelters are working. Two of our shelters are really at capacity now for overflow. Neville Street and the IW Progress Place. They have early in the season, even though we have warm nights, we started overflow on November 1st, but for the last couple of nights, they've been at capacity. So the shelters are really geared up to meet the need and the demand. But as we remember last year, the demand for overflow exceeded their capacity. So we partnered with Shepherd's Table to provide additional space in their kitchen. And we're looking at that as a continued option. But the shelters are geared up with staff. Security is increasing at Progress Place. We're working on that. But there are a lot of, for lack of a better word, moving parts that we manage daily in order to meet the need. But there's always a need for additional staff and additional resources like mats, which the shelters have requested, that the shelters have already ordered those and are in the process of getting additional ones.
Okay, well, it's good to know that staffing cuts are not on the horizon. How can the council support emergency planning in the event of any further delays from the federal government?
Yeah, I think as we're working out our different responses to what we're expecting in the notice of funding opportunity, as you have all said, and always, I always find this to be true, just standing ready to support. These are all details we have to agree upon and discuss together in HHS and, of course, with the county executive. So I think it's really, as you always are, right there with us, aware of the challenges before they even hit and ready to support. I can't thank you enough for that.
Of course, and I know Council President Stewart mentioned, her role with COG. I know that with, the encampments being, shuttered out of the district, I know that we've seen an increase in our shelters. Are you able to put a number on how significant that increase has impacted our shelter capacity here?
The only data point that I'll speak to right now is in the 2025 point in time count, it was 35% of individual adults, so that's not including families that did not report their last permanent residence being in Montgomery County. Okay. Having said that, we all know that homelessness is fluid. People experiencing homelessness have connections across the region, and it is part of the experience of homelessness that you would be transient. You would go where you can find support. And so that is part of our work to know that, but also to continually collaborate. And I know I say that a lot, but I do think that there are very, very good communications happening across the region, and that our county leadership, the council president, the county executive are supporting those conversations. So I do think there is a possibility and a likelihood that we will move into better collaborations, and that I know that you're all ready to support that, both on the COG and in those conversations as we work out some of those solutions together.
Okay, we will stand ready. Thank you. I yield.
Thank you.
Thank you all so much. Just one final question and then a comment as we close. We always have constituents that want to help, that want to volunteer, or that see somebody in their community that they would like to be able to refer to someone. What should we tell those constituents? First, volunteers. Where should we direct them? Where can we encourage them to go? We obviously have amazing nonprofit organizations doing this work, but any direction there. And then secondly, when we do see somebody new in our community who does look like they need assistance from this remarkable team, how should they go about seeking it?
Wonderful question. Thank you so much. And I just got out of a meeting where we were talking about the next point in time count that will be happening in January. And we are expecting a decrease in volunteers because many of our volunteers were part of the federal workforce, and they're struggling now. So definitely, if there's an interest in understanding homelessness in a direct way, we would love to have volunteers for for the point in time count. We just had Homeless Resource Day last week, where we also needed volunteers, and many thanks to Gloria Huggins for her amazing work there. But so that's for the point in time count in January, and we will definitely be pushing that information out as we are planning that. But in addition to that, I'm going to pass it to Ms. Taylor and Ms. Anderson for volunteer work and donations that our emergency shelters may need.
Got me on the spot. As I think about it, I think one of the biggest needs, we're approaching the holiday season. In past years, we've collaborated with organizations that did like giving trees with gifts for our youth who are experiencing homelessness. So I'm certain that's going to be a need. All of the organizations are being hit pretty hard. So I anticipate a reduction in those offers to support our families and children. In addition to that, 3 of our shelters and certainly our families that are homeless and in Overflow Motel would benefit from any support around holiday giving, whether that's gift cards, the old angel tree where kids get to do their wish list. That's the thing that comes to mind right away. And in addition to that, we also have families that, thanks to all of our efforts, are exiting homelessness to permanent housing. And there's always a need for those basic home necessities as you're moving into a new place, whether that's cleaning supplies, welcome home baskets some providers have done. That's another thing that is often very helpful for our families as well.
Thank you.
In addition to what Denise mentioned, of course, adults need those resources as they're moving to housing as well. But recently I was at the men's shelter and I met for several hours with my staff talking to the men. And in my opinion, what the men need really are mentors, different people that are coming into the shelters, developing relationships with them, helping them to improve their self-esteem, talking about financial planning, some concrete people that can not only give things, but give of their time and share some skill sets in terms of how people can manage this ever-changing landscape.
Great. And then if our constituents see somebody in the community that looks like they need help, particularly as Council Member Sales mentioned with hypothermia, where should they go? Who should they call?
Thank you. One moment. This I didn't have written out. Okay, so our homeless information line, it has changed a bit. So it used to be that we received just general tips and calls from the community about people experiencing homelessness that they may see. It's changing because the funding has changed. And so it's still the same number, 240-907-2688. And when they call that, they can, this could be someone who needs services. They would be able to access diversion services. And if diversion isn't successful, then a referral to shelter. And that line goes to the crisis center because the diversion staff work during business hours, Monday through Friday. So on evening hours, weekends, it would forward to the crisis center. And then in addition to that, for general information about resources, which the homeless information line used to assist with, that can go to 311. So, and 311 is very good because that is also the way a household could access housing stabilization or some of our other programs. So that's a general line that could be shared. And then, of course, for behavioral health support, 988. But the homeless information line is specifically for households, individuals who are currently, they've lost housing and need diversion services or referral to shelter.
Great. Perfect. Thank you. Just close with two comments. First, an acknowledgement. So just a point of privilege. I do want to thank my Chief of Staff, Beth Schuman, who has served as the liaison from the council to the SEF committee. She's upstairs watching on TV. But just want to thank Beth for being our eyes and ears on the council and being so thoughtful and being representative. And through the partnership and alliance, there are many, many phone calls that happen that people never see, don't know about, but really want to appreciate your responsiveness. And I'll just close with this thought. Your work is very hard, very hard. And we just have such deep respect for the important role that you all play in our community that extends, in addition to this remarkable team, all the folks that are on the ground, the volunteers, the staff. Every year I make it my business to go to the memorial service that SEF produces to acknowledge our neighbors and friends that we've lost over the last year. And every year I get very emotional hearing the stories and the humanity and the love that is shown during that particularly important session every year. But what I'm always struck by is how deeply you all care about these individuals and treat them as members of your own family. So I just, on behalf of the committee, and this is one of my last sessions signing off before I join you all on a different side of the aisle, I just want to express that gratitude. I have supreme confidence in Ms. Clemens-Johnson and our central staff, who will continue to lend their support and be able to guide this and future councils in this work. so that we can give you all the tools and resources you need to be able to do your jobs, because we know how important they are and how well you do them. So thank you all, truly, from the bottom of my heart.
And I won't let you have the last word. I'm going to take it because I have to thank you, Councilmember Alvarez, for the years that you have served on the council and been a consistent voice of compassion, always asking insightful and thoughtful questions, always letting us know you're here to support us, understanding the needs of our staff. I remember still my interview and how you pointed out how amazing the HHS staff and the CEF staff are. And that has come over years of development and years of support from the council in developing the infrastructure that is CEF. And so I can't thank you enough for your service to our community. And I will certainly miss you on the council, but I look forward to working with you on the executive branch. So many, many thanks for all of your work and your service to our community.
Thank you. Thank you. That means a lot. Councilmember Lukey.
Well, this might be the last time I get to sit next to you as an HHS committee member under your leadership. I know that your heart-led purpose and passion will continue, and you'll be back before us in a different capacity. But it's been a tremendous honor to be able to serve on this committee with you and to learn from you and share with you. And you have always been 100% open and receptive to me as a new member of the council who's not so new anymore, along with Council President Stewart over here. But thank you for all that you have done for us, for our community, for the council as a whole, and that you will continue doing in this next chapter. We appreciate you.
Thank you all so much. I'm blushing. You all are the best. Thank you. And with that, we are adjourned. Appreciate all of you.